Hey guys, it's Maggie and I'm back today to talk about pelvic floor therapy. If you don't know who I am, I'm a 27-year-old nurse who also happens to have Crohn's disease and an ostomy bag. So we talk all about it on this channel and I try to be as open as humanly possible, which means sometimes we gotta talk about our vaginas. So just to give a quick background, I had my colon, anus, and rectum removed over a year ago to basically give me relief from the disease that was going on in those areas. And I now go to the bathroom into an ostomy bag, which sits right on my belly. The amount of times that I've said like, oh yeah, I had my colon and rectum removed, and people are like, whoa, how do you go to the bathroom? That's why I just have to repeat a couple times like, I have an ostomy bag and that's how I do those things. Yeah, so I'm going to talk about my experiences with pelvic floor therapy, why I even went to pelvic floor therapy, and why the heck is nobody talking about it. Before we get into it, if you'd like to follow me on Instagram, I am back on Instagram with the name Maggie Tretton. And I am still on Facebook and TikTok as LetsTalkIBD. So if you'd like to follow a little bit different content, that is where you can find me. And second, this has nothing to do with anything, but you guys know I got my hair cut and I struggle with my hair. I recently found this product. I just like on a whim bought it online. My hair is kind of frizzy. I don't know why. I try different things and it doesn't really do anything for me. Either weighs my hair down too much and I look like I haven't taken a shower in 2 weeks, or it just doesn't help with the frizz. But as you can see, my luscious locks are shiny and beautiful. I've always really liked their makeup brand, but I decided to just go on Amazon and get this Pacifica, what is it, coconut milk detangle elixir, I'm sorry. Hydration and rehab for naughty nuts, which is definitely what I got going on here. Anyway, maybe you can tell. It's like shinier, but it's not weighed down. Thought I would mention it. And then I also got their Salty Waves texture spray, which is what I've been using when I curl my hair. So both of these I will put down in the description below. I'll put my Amazon links to them. I don't know. I thought I would mention it because I feel like a goddess today. The third thing that I wanted to bring up before we get into it is I'm going to be making a couple more videos about this. One video on dilators, one video on exercises. Let me know if you have any questions or anything that you're interested in seeing with either of those topics, so I can be sure to include them in those videos. And the fourth and final thing that I'm going to say before we get into pelvic floor therapy is that I am just a patient sharing my experiences. This is not meant to be used as medical advice. It's meant to hopefully encourage you to see a pelvic floor therapist. So when I talk about the dilators and I talk about the exercises that I have been prescribed by a pelvic floor therapist, it is more to show you what to expect than me telling you what to do, because I'm not telling you to do anything. Go see a pelvic floor therapist. All right, let's talk about pelvic floor therapy, the real reason you guys are here. We'll talk about our vaginas and whatnot. Actually, to start, let me say, pelvic floor therapy is not just for females, it is for anybody. I know that my pelvic floor therapist sees both men and women, so don't shy away from this. If you are a man and you are having trouble because of surgeries you may have had or disease processes, you may have going on. I only knew about pelvic floor therapy because of my telehealth nursing job that I had. It was something that we recommended to ostomy patients, particularly just because things get funky down there. It's all in the abdominal cavity area, and women can have a lot of trouble, especially with sex. They get a lot of pain. Men can have erectile dysfunction issues. I'm going to be honest, I am not super familiar with that. I would not feel comfortable talking to a male patient about those issues just because I don't know what I would offer to that conversation other than a listening ear. But now that I went through the proctocolectomy surgery to remove all of those pieces inside of me, turns out, which I didn't know before surgery, and I'm not sure my surgeon even realized it, and a lot of people have said, well, your surgeon should have warned you. I'm not sure how many patients went back to him and complained of this issue. I do tend to be a little obnoxious, so I may have been one of the few that were like, I'm not dealing with this. Somebody better fix me. So I'm not sure if, he just was aware that this was a possibility for people. In theory, it makes a lot of sense as to why I was having the issues I was having, but if people aren't complaining about it, well, might not be on the top of your mind. So I was interested in pelvic floor therapy originally because of my surgery. I knew that things were going to be funky when you have your anus incision, or your incision where your anus used to be right next to the entrance of your vagina. There's bound to be some problems in there, especially with intercourse. I talked about it, thought about it, all of that for a year after surgery. I kind of made do. I even made a video talking about how I was doing with intimacy and all of that post-surgery, which I wasn't doing fabulous, but I wasn't doing awful. We didn't have sex for a couple months after my surgery just because I was so afraid of things being ripped open, but slowly started to ease into it. I did have quite a bit of pain, but I learned to sort of breathe through it, and it was all right. Got through it. The main issue, though, that I was having was all of this drainage, and I didn't know why. I had all of this discharge, essentially because your rectum supports your vagina and the muscles. When you take one organ away, the vagina kind of has the ability to sort of shift and maybe pocket outwards into where the rectum used to be, therefore creating a pocket where fluids can collect. So throughout the month, when I would have my normal discharge, because it is totally normal for females to have discharge throughout the month, and it changes depending on, what hormones are going through your body. But essentially what was happening, and I had no idea, and my surgeon didn't have any idea, was that it was collecting in that pocket, and then once the pocket sort of filled up, it would all come out at once. And it was horrifying. And the same thing with my period. It would all collect in that pocket and then empty all at once. And it was a lot of blood coming out at once. Because it was collecting for long periods of time, it became a bacteria breeding ground. I got multiple yeast infections. I got bacterial vaginosis. And I was like, what do I do? Kept trying to treat it. It would go away. It would come back. Went to the gynecologist multiple times and didn't really know what was going on. They thought it was a fistula at one point. They thought I had a rectovaginal fistula, which doesn't really make sense because I don't have the rectum, but I guess they thought the cavity may have had an abscess or something that was now leaking into my vagina and coming out. Got a CT scan and was cleared of a fistula. Thank goodness. Didn't want that to be the case. But I was still sitting there like, I don't know what to think. I don't know what to do anymore. Until my good friend Noelle, who has not yet had this surgery, actually did a consult with her surgeon who warned her of this. He was aware that this could happen. So I brought it up to my surgeon and my gynecologist, and they both were like, that seems very plausible. But still, I was not in pelvic floor therapy at this point. And the pelvic floor therapy did not happen until something totally random. I went to get an MRI done a few months ago for just a regular checkup for GI stuff, for my Crohn's disease. I get them done yearly, so I got that done and found out that they saw adenomyosis. I'll tell you what, I have heard so many conflicting pieces of information. I kind of have done my own research and repeated back to you guys what my gynecologist has told me, and then I get a lot of people bombarding me telling me that I'm wrong. I was told that adenomyosis and endometriosis are related. They're not the same, but they're related, and I was told that if I had adenomyosis, it was likely I probably had endometriosis as well. I don't think I have endometriosis. I had kidney surgery over the summer where my surgeon cleared me out of scar tissue, but he never said it looks like endometriosis. I do not claim to be the end-all be-all of adenomyosis and endometriosis information. I also said I never had symptoms, and people have told me that you can have very severe adeno and endo and have no symptoms at all, whereas some people can have really, really bad symptoms, but only be like a stage 1 endometriosis. I think that's how it's staged. Literally couldn't tell you. But anyway, found out I had a focal spot of adenomyosis in my uterus, which meant that the uterine muscle, the uterine tissue, the lining, was kind of burrowing into the muscle layer of the uterus, which it's not supposed to do. Also found out that this can happen because of surgery, like a scalpel could pick up some of that tissue and push it deeper. I thought maybe that was a possibility. I don't know. But what I will say is that I had no symptoms until the month that I found out I had the adenomyosis. I started spotting before my period, which was a little unusual for me. I spotted for 4 or 5 days, 3 or 4 days, I can't remember. Went to the gynecologist concerned because I read online that adenomyosis can make it difficult to have children, and I was like, well, that sucks because I just got married and that's something we're interested in. So let me go to the gynecologist and find out. Was told that there was no way to know if I had endometriosis until I had laparoscopic surgery done. I was like, I'm not feeling anything bad, and I just got cleaned out of scar tissue, so I feel like I don't want to go there. Neither did the gynecologist. But what she told me was, try to conceive for 6 months, because with your regular cycles that you have, there in theory shouldn't be an issue with getting pregnant. But we also realize you've had a ton of surgery and there could be potential damage to your fallopian tubes that we just don't know about. At that point of 6 months, because we don't want to let it go too far, I would get a hysteroscopy. Anyway, I've talked about this before. But the other thing she said she wanted me to do was to go to pelvic floor therapy because, there might be muscles that are too strong in there or too weak, and I'd be able to work on them and get my uterus basically into the best possible condition to conceive and carry a pregnancy. And I was like, that's great because I've been interested in it for my proctocolectomy surgery as well. And she was like, you know what? That'll probably help that too. Spoiler alert, it did. So let me talk about my experience going to pelvic floor therapy because I think it is scary for people to go into it. Obviously, it deals with your internal organs and your vagina if you are a female. That's what I'm speaking of from my perspective, so that's what I'll mainly talk about, but I told you in the beginning, dudes, don't stop listening. So the first appointment was just me kind of going over my medical history, telling her about all of my surgeries, as well as examining me and how I hold myself. So she kind of had me stand and she looked at my muscles and how I carried my weight. Basically, we found out a few things that might be kind of interesting to you, especially if you've had surgery before. So, the lower half of me, like my waist down, I apparently carry all of my weight on my left leg. I lock my knees, I lock both of them, but my weight is shifted mainly to my left side, which in turn, as we found out, made all of my muscles on my left side extremely tight. Didn't realize how painful they were until she started rolling them out, and I was almost in tears. We thought this might be because most of the surgeries that I've had have been right-sided surgeries, so I'm kind of favoring my right side. My ostomy is on my right side, my kidney surgery was my right side, so she thought, maybe your left side is trying to carry the weight because your right couldn't for so long. Which makes a lot of sense. In opposition though, on the upper half of my body, my right side was a lot tighter because I'm right-handed, which makes a lot of sense. I use my right arm, my right hand a lot more than my left. So I apparently had all these knots, and I can still feel them, but they're way better because she worked them out, but I was very tight in my shoulders. Also, I have a pretty large midline scar that she had me massaging out, and she often will massage it herself because I'm a little squeamish with my incision. I don't know why. It's super numb to me, so I can't really feel it, but it freaks me out. This was extremely tight because for so long I didn't want to move my belly. I went through many periods of not wanting to move my belly at all because you're just afraid you're going to rip it open. So she started me with a roller, and she started me with some gentle exercises or stretches that I will show you in an upcoming video. This is the roller that I use, and I use it on the inner leg muscles and on my quads, and I just didn't realize how tight I was until I started rolling out with this. Super painful, but afterwards you feel really good. She also noticed that my posture was very like this. I leaned forward a lot. I had a couple people comment on my posture like, "You're young, why are you?" I got major abdominal surgery multiple times, and wherever you have scar tissue, it's contracted. It's just not as pliable and flexible as regular skin. It's really uncomfortable for me to stretch out like that, or at least it was for a long time, which is probably why my shoulders were like this, because I spent a lot of my time hunched over after surgeries. But we've been working on getting me to open up, again, more exercises that my pelvic floor therapist told me to do, which has helped kind of open up my stomach, along with abdominal breathing. Instead of breathing up here, breathing in my tummy area. So the second appointment, we did the internal exam. I was like geared up and ready to go for the first appointment on that, thinking like, oh, it's pelvic floor therapy. Clearly that's like the only thing she's focusing on. Not true at all. But we did get to it in the second appointment, and what she found is all of the muscles around my vagina were extremely tensed, extremely tight, so she began working them out. And when I say working them out, I tried to explain this to Zach because I don't know what the heck he was picturing, but basically she took her finger, pressed it against the muscles inside of me, and just held it there. And sometimes it was super uncomfortable, and she would like kind of ease up. They're very good about assessing your pain, and she used a ton of lubricants. It was not severely painful at all. She was really great about reading my face when I'm like, oh, that hurt, and constantly asking me if I was comfortable, so that was great. She would press down on the muscle to try and loosen it up a bit. Over the last couple of months, it's a world of difference. It is so much calmer in there. What she kind of speculated was that my vaginal muscles were trying to do the job that my rectum did, but now that I don't have the rectum in place, it was just trying to make up for it. So everything was trying to keep me held together. When I first started, she would also basically have me try to do a Kegel, and she would feel to see, okay, do I have a lot of strength when I do one, and can I release it? My strength wasn't super great in the beginning, and I couldn't tell if I was releasing it or not, and apparently I was not able to. So we really had to work on that. She taught me how to kind of feel my tailbone drop when I relaxed, which helped a ton. That was kind of like my telltale sign that I am able to relax the Kegel. She said it's very common for people not to really be able to tell if they're relaxing it or not. I thought, I was like, are my nerves damaged in there and I can't feel things I'm supposed to, but that really wasn't the case. It was just, it's hard to tell. It's just hard to tell. I also did have some external pain from where my incision was. She didn't even go back there. Like, she was very gentle around that area. Because I'm a year out from my surgery, or over a year out, it's healed now, and it was okay. So people have asked me, is it painful when they do the internal exams and whatnot? In that regard, in the external regard, not at all. She also felt that there was indeed a pocket where my rectum used to kind of support. There is just an outpouching of my vagina where fluid was collecting. And while I'll say that it still collects there, there's not really a whole lot I can do. I know that people have said, meshes and whatnot. I don't really want to go through another surgery, and if I can handle it with other techniques, then I will. But what I will say is, because things are more relaxed internally, I am able to now feel when it's getting full. I can actually feel pressure on the bottom of my pelvic floor when it gets full of that fluid. I can hold it until I get to the bathroom, and then I can relax and get the discharge to come out by itself. So it's really, that sounds really bizarre, but I'm able to do that. I would say basically since I started pelvic floor therapy, it has not come out on its own in an uncomfortable time or place. I am able to control it better. The other thing that helps me is dilators. We started on dilators, not so much to stretch things out in there, more so to make me comfortable with something being in there. But I also noticed a secondary thing that is very helpful. When I put the dilator in and I take it out, it's almost like it's creating a pathway for the discharge to come out. So I will do it in the shower and the discharge comes out. Do it once a day and I'm usually pretty good the rest of the day. All of this that we have worked on so far has made sex so much better. Not only internally, but other parts of my body, like my legs. I didn't realize that my legs were not supposed to feel uncomfortable during sex. I don't know. I just didn't realize how tight my muscles were until they were not tight anymore, and it has made me so much more flexible and comfortable during sex. I'm like amazed. It has truly made a world of difference that I didn't expect. I thought, yeah, it would probably help a little bit, but you know, whatever. No, it did things that I wasn't even thinking about. So when I say that everybody should go to pelvic floor therapy, holy cow, we all should go. I don't care if you're healthy or not, how many surgeries you've had, if you've had 0, you should go. So hopefully this video has eased your mind, maybe given you a little bit more information about pelvic floor therapy. I hope that you have one that's near to you, that's available to you. I can't recommend it enough, and if there is a surgeon or a nurse that works in this surgery field that's watching this video, please recommend your patients go to pelvic floor therapy. It makes a world of difference. I didn't know I could be this comfortable. You just kind of assume like, oh yeah, you've had a lot of surgery, so things are going to be a little funky and you're not going to feel 100%, but maybe I don't feel 100%, but I am like so much better than what I was 2 months ago. Alright, so anyway, I know I've talked for a while. Guys, thank you so much for watching this video. And if you have any questions, leave them below. Any comments, leave them below. And I will see you in the next. Bye!